All right, it's my turn again?
Yes.
My turn
so
again.
You
All right. So here we go. So now we're going to be talking about the next society, which is IBEROAMERICANA. Thank you all for joining. This was also the first year for IBEROAMERICANA. So thanks for joining. And they sent us their top 3 papers from this year. The first is Dr. Maria Velayos, who's a 5th-year resident of pediatric surgery at La Paz Hospital in Madrid, Spain. And she created a initial training model in microsurgery in the rat. And this is a preclinical study which was meant to describe an initial model of training in microsurgery using rats and to look at the learning curve in that model. So that was the first paper. The second paper is Lourenzo Sbragia from the University of Sao Paulo, presenting the analysis of risk factors for neonatal short intestine syndrome in 2 tertiary centers in Brazil. This is a retrospective study that aimed to evaluate the evolution and variables that influence the death in neonates with short bowel syndrome between 2000 and 2019, so almost a 20-year study. And the third is Dr. Maria Jose Rosell Ecarvia from Nuestra Senora. You should have done these. They're all in Spanish.
She's from Spain too, yes.
She's from Spain. They looked at urinary osmolarity, the useful parameter to assess renal function before and after surgery for obstruction of the uretero-pelvic junction. They did a retrospective study from 1980 to 2021, and their aim was to determine the usefulness of basic renal function markers to assess renal function in patients with UPJ obstruction and to know the most sensitive marker for renal damage in these patients. So we have the microsurgery in the rat model. We have the study of short bowel syndrome in neonates, and we also have the study of UPJ obstruction and markers for that. So why don't we take to the polls, and we'll see you in a minute.
The latest version of Stay Current allows for healthcare providers to stay up to date in medicine by aggregating the best multimedia content all in one place. Their order sets, protocols, guidelines, videos, directories, and even their favorite website links. No more having to go to the intranet or a 3-ring binder. Introducing Stay Current Spaces, a digital, shareable file box within Stay Current. Let us know if your hospital or society would like a space.
All right, we are back. So it looks like the winner is analysis of risk factors for neonatal short intestine syndrome in 2 tertiary centers in Brazil. So let's go ahead and I know I didn't give you much warning there, Carolyn, but if we could roll that video.
Good morning, good afternoon, ladies and gentlemen. Thank you for the opportunity to present our paper. Conflict of interest. Short bowel syndrome is defined as the malabsorption state resulting from extensive intestinal resection. Intestinal insufficiency is characterized by the loss or decrease of intestinal absorptive capacity to maintain nutritional status exclusively through the enteral. The sequel, short bowel syndrome incidence is 24 cases for 1,000 live births and global neonatal mortality is 37%. Our aim was to evaluate the evolution and variables that influence the death of newborns who were diagnosed with short bowel syndrome and ultra short bowel syndrome in 2 tertiary centers of neonatal surgery, which was approved by our clinical research. It's a cohort test of 18 years, 50 neonates, and the data obtained by reviewing medical records. The demographic data that we studied were 13, and the criteria of inclusion was short bowel syndrome less 60 centimeter, and ultra short bowel syndrome lasts 25 centimeters, no ileocecal valve, and creatinine exclusion or other malformations, genetic syndromes, and remaining intestine more than 60. Our results, our statistical analysis compare two groups by Fisher test and Kaplan-Meier tests, and all this. Our results, we have 53 short bowel syndrome, 20 survive, 30 short bowel, and 23 ultra short bowel syndrome. Diagnosed 55% NEC, 20% gastroschisis, 10% intestinal atresia, and 10% mid-gut volvulus. The demographic results, most of them are male, most submit to cesarean section, adequate for gestational age. The weight is the premature to 75%. They need implantation of venous catheter 73%, and need of NPT 70%. When you compare short bowel versus ultra short bowel, we found the full adaptation and remaining bowel length had difference between groups, but there were no difference between death. Potential risk for values for death was TPN, not able to get food adaptation, and not able to get enteral nutrition. This is the curve of TPN influenza survival. It's time food adaptation influenza survival curve. And the potential predicted for death was time for definitive surgery in days, and wait for discharge or death in loss. Evolution for ultra short bowel syndrome was small for gestational age. The potential short bowel syndrome according to diagnose NEC versus no NEC, less than 25 days of loss or survival. This is our general survival or final weight to discharge in 20 patients. Well, in conclusion, ladies and gentlemen, thank you for your attention. High morbidity and mortality in neonatal surgery was 57%, and avoided complication and sure TPN during the adaptation period had a significant impact of survival. For authors and other institutions, gracias, thank you very much.
All right.
Okay, so that was super interesting. I really like it. I mean, we know that short bowel syndrome patients are really complicated, and there are new therapies now going on, but it's good to know that assess them with a good TPN that maybe in other countries, that's, I don't know, for Argentina or Latin America, sometimes it's quite difficult to have perfect for that. And okay, so it's they have a bad weight when they leave, or they are not used to TPN, they may have some more complications. So to ensure that is the best for these patients.
All right, Brittany, Ellen, or Tony, comments? Tony?
I don't really have any comments. I couldn't understand whether this was neonatal death or overall death with a high mortality rate. It was a very high mortality rate of something like 50%. So I missed that part, and I didn't really see what criteria in this paper would predict how patients would do. Was it purely the length of the intestine, or was it complications during the neonatal period?
Both. Was actually the length of stay. If you have the length of the bowel, like if you have a ultra short bowel syndrome, was worse. And if you have if you couldn't get the patient to gain weight, was a predictor for that. It's not neonatal exclusive death, but it's not a great follow-up. What's included first year.
Tony, did you want to follow up to that, or no?
No, I think it's very important. You know, most of our patients, if they're not decided at the time, if they have total necrotizing enterocolitis, for example, and the decision is not to continue therapy, most of our patients will survive with short gut, with ultra short gut. The question is the long-term survival. How many go on to liver transplant or intestinal transplant in the in the American system?
That's a great point, Tony. That's the number that matters, because initial survival is not important as are they going to make it to transplant. And unfortunately, the author couldn't make it here. But that's a follow-up question that we can ask and post that question on social media as well.
Some questions from the chat. And so one of them is that it was interesting. There's 33% of patients had an ostomy. And how are those patients different from the patients who didn't get an ostomy? And then was there a protocolized or standardized post-op care for any of these patient groups?
Right. So we're kind of disappointed that the author couldn't come here. Here's what we'll do. I think what we'll do is we will ask him these questions, get his answer, and then I'm going to ask Ellen, Brittany, and Cecilia to make a summary video that's about a minute long that answers and addresses more clarity on what are we actually measuring as far as survival and these other questions. So
Okay,
good discussion. Thank you.
right.